So these are the other accessories that come out of the box. These are mostly used for cleaning your blaster after you have used it. So this is the first accessory. You will remove the protective covering. Again, this will be very similar to your chair coupling. So this will go and fit onto the chair like the blaster. You remove the blaster and then you fit this onto the chair. Make sure again it is tightly secured and this is ready to be used. You have a brush to clean the chamber. You have two different pins, the long pins to clean the longer part of the device and the shorter part of the device to be cleaned with the shorter pin. Let's look at how you will clean the chamber. So let's look at how you would clean the blaster after it has been used. You would first open the chamber, take out all the powder on a tissue paper. Make sure all of the excess powder has been taken off. After you do that, you can keep the tissue paper aside. Please do not put this in the main box. You can have an empty box in which this can be placed. You may be able to reuse the powder then. So once you've kept it aside, you pick up the cleaning device and first blow air into the chamber, making sure that all the powder residues are gone. Once the powder residues are all gone, seal back the chamber. Now you can use this device to again clean the head of the blaster. You will put it in, and this doesn't have a very tight fit, so you will have to hold it and now blow air. Air would come out, removing any powder residues out of this chamber also. You can now pack it here and make sure you blow air once to remove any possible powder residues along these areas also. Once you've removed all the powder residues, now we begin on how you would use these needles. Okay, so let's look at how you would use these needles and what you would clean with the needles. First, let's take the larger needles, and this needle goes exactly into the hole that will be there on your tip. Once you insert the needle, you can see that it's only almost the entire needle until this part would go inside. Only a little part of the needle would be visible. Make sure that the needle is completely inserted. If it is not going in, you might have to push it a couple of times, making sure that you are removing any powder or debris from here. Once you are able to push the needle in completely, you can remove the needle and now pick up the smaller needle. The smaller needle would clean the tip of this blaster. It will go into the front tip and make sure that there is no powder entangled here. Apart from this, this needle would be used to clean the front part, not the part that gets attached to the chair, the front part of the plastic area. You would put the needle inside, there's a hole there, you would put the needle inside and make sure the needle is going completely. Again, this needle can also be used to clean the front part, making sure the needle goes in completely. So this makes sure that this needle reaches till here from the front, and this makes sure that the needle reaches again at the same point from the back also. You do not want any powder to get entangled here. Okay, so it may happen that you've not cleaned it properly and you've used it for a couple of times and this part of the blaster has got completely blocked and you are not able to put your needle through. In fact, the needle just goes almost halfway or even 1/3 sometimes. Now in such a case, you will take EDTA solution, load it in a 30 gauge needle and put a few drops of EDTA from the hole in behind. Once you put a few drops of EDTA, you may now take the needle, hold it vertically and try to pump the EDTA through the chamber. You can see the EDTA will start to come out. Once the EDTA comes out and you are able to put the needle in completely, rest assured that this part has got clean. If you still feel it is not clean enough, you can take the needle from the front, the smaller needle, and start cleaning the front part of the device with the needle. Once you've done that, again go back and blow some air through the front part making sure all of the EDTA solution has been removed. This is usually not required if you are cleaning this every day, but you may need it if your cleaning procedure is not thorough. After you've done this, you will take this in a pouch and then you will sterilize it in a Class B autoclave. This is what will go into the autoclave. Again, this will not go into the autoclave. Thank you. So there will be times when your blaster is completely blocked and you are unable to recognize whether this part of the blaster needs to be cleaned or this part of the blaster is blocked. So for this, what you can do is always connect the coupling first. Remember the cleaning coupling, and now start to blow air into this part. If you feel the air is coming out properly with pressure, that means this part is relatively clean. You will not have to clean this part anymore. Now remove the coupling and attach the blaster to the chair like how you would normally do. Attach the blaster to the chair completely. Once this is attached properly, now you want to check whether this part is blocked. For that, put your foot pedal on and check if there is water and air coming out freely from this part of the handpiece. If both air and water are coming out freely, that means this part is not blocked. If air is coming out freely from this part, that means this part is not blocked. So you will have to select which part is blocked and selectively clean that part. Please do not go about cleaning everything every time. You will have to understand which part of your device is blocked and you can go ahead and clean that part. Thank you.